Our motor skill is a back squat. A back squat is classified as a closed skill, as the learner initiates the movement and it is performed in a predictable environment. It is classified as a gross motor skill as it requires large proportions of the lower limb musculature, including quadriceps, rectus femoris, gluteus maximus, and adductor magnus, as well as the trunk for stabilization. Finally, the skill is classified as discrete because it has a defined beginning and end initiated by the participant. In regards to Gentile's taxonomy of skill classification, a squat is classified in regards to environmental context as number 3, stationary and fixed. Action requirements require body transport only, and regulatory conditions are stationary and fixed, as the feet are fixed and planted to the ground. There is no inter-trial variability because the skill doesn't change in itself, the variables can be manipulated. Previous studies determined that optimal technique would include a wide foot stance approximately shoulder width apart, a natural foot position specific to the sport with heels remaining in full contact with the floor at all times, unrestricted movement at the knees, gazing forwards or upwards to help balance. Hitting full depth of the squat is preferred, provided the lordotic curve of the spine maintains. This is a slowed down example of a beginner box squat, where we can notice he has a curved lordotic spine and is tilting forwards. His motion is similar to a vertical leap takeoff.
Quantitatively, to determine if learning was occurring throughout the program, a Likert scale was used, rating the precision of the movement in relation to the key aspects of the skill mentioned previously on a scale of 1 to 5. 1 being strongly disagree and 5 being strongly agree. This performance measure was administered at the beginning of each successive week and after a month of successful completion of the program to determine if the degree of permanence was maintained or if it was only a temporary effect due to consistency of the program. The exact same protocol administered for the quantitative assessment was used for the qualitative measure of the squat. The essential components of the skill were used as a baseline criteria in which observation of the participant would dictate a yes or no response, meaning is criteria met or not. Additionally, a comment on general performance and potential improvements are made. Throughout the first half of the program, feedback was given to the participant in order to improve performance. In the latter stages of the skills training project, the participant was expected to be able to identify and attempt to correct technique flaws. This is an example of active problem solving in regards to the learner. A retention test will be performed in order to assess if skill acquisition throughout the program can be reproduced over a time interval. In order to assess changes, footage of a learner will be compared from initial performance in week 1 to post-intervention in week 4. Thus, retention shall be measured under the same conditions as week 1. To further assess the learner's active problem-solving abilities and assess what has become cemented in their mind as essential in regards to the completion of the barbell back squat or the squat, the learner will teach the coach as if he were a beginner the key mechanics, cues, and elements of the squat. Transfer test was administered in order to assess the participant's adaptability after the 4-week program. A front squat was introduced in order to assess if there would be a positive transfer learning effect. If the participant is successful, or we see some evidence of transfer, it is most likely that they have moved out of the cognitive phase of learning and into the associative phase. Similarly, we assess the participant pre and post intervention in regards to their vertical jumping ability to determine if the program transferred to greater athletic performance. Accelerated curve, in which improvements is greatest early on in the program and then tapers off. In order for learning to have taken place, performance should increase consistently throughout the program. The participants should show signs of adaptability in regards to similar movements, and stability throughout varying situations and environmental contexts should be achieved. In accordance with Fitz and Posner's 3-stage learning theory, it is expected that the participants will move from the cognitive stage, in which they attempt to understand how to perform the movement, to an associative stage, in which the learner begins to actively problem solve and alter the movement pattern without the need for verbal cues from an external source. For example, identifying that their knees are caving inward whilst moving through the eccentric phase of the squat.
So our participant currently plays basketball and has done so for 10 years. He's always had a decent vertical leap, which would suggest that he incidentally knows how to perform an explosive bodyweight squat. This is advantageous to him as it can reduce the time spent in the cognitive stages, since we can assume that the fundamentals of his jump are correct. The main difference, however, between a vertical leap and just an ordinary squat is that the vertical leap is a quick and explosive movement, and as a result, no thought is put into the movement except, jump as high as you can. A squat in relation to the leap, however, is long in duration that requires mental thought, such as awareness of posture, knee positioning, and foot placement. Having a decent vertical leap, we can assume that he would have good muscular strength in his legs, which would allow us to focus on the technical aspects of the movement, like learning how to brace the trunk and keeping a lordotic lower spine. In contrast to what we'd expect with good foundations, we may see some negative transfer where Perkins and Salomon in 1992 defines it as when learning in one environment negatively impacts performance in another. We could therefore see poor habits formed in the vertical leap that may make teaching in the regular squat a bit difficult, as the participant may find these habits hard to change. Since he already has a basic understanding of a squat, we can focus on proper upper body technique due to his already developed leg strength as stated in the previous slides. This helps with improving the simplicity of the task, allowing us to fix weak points at a faster rate than trying to fix it all at once. We'll be aiming to get the participant to externally focus on moving the bar up and down in one plane of motion. This will help keep his spine in the appropriate posture without having to deeply think about it. If we try again to internally focus on the posture, we may be challenging his already developed motor skills, which could complicate the task and increase the time needed to master the technique. So the long-term goal is for him to gain high levels of strength in his legs to improve his vertical jump and acceleration on the basketball court. The short-term goal in the program is to have the participant successfully perform a squat without needed feedback, and to in fact teach the trainer how to perform one. By successfully teaching the trainer, we will be able to conclude that the participant has mastered the technique and can retain the information he learnt from week 1 onwards. In the program, we focus on mastering each aspect of the movement whilst increasing the difficulty week by week, just to ensure the participant doesn't get too bored. Since the participant is determined to jump higher, he will intrinsically motivate himself to work his highest level. Here is where the recommendation of mental imagery comes into play, envisioning successful squats and progressively higher jumps. This will increase arousal levels to the optimal zone of a squat, thus resulting in greater output levels. To ensure that good habits are formed, our program focuses on a segmentation approach where we reduce the complexity of the task by breaking it down into small parts. This will ensure the participant can focus on one thing at a time to prevent him from feeling overwhelmed by the exercise. This is seen as week 1 gets a participant to squat only halfway to a box, eliminating the strength required to stand back up, allowing us to focus on his spine and trunk. Here we can ensure an upright posture and focus on contracting his erector spinae muscles. Week 2, we build on week 1 skill by removing the box to allow the participant to complete a full range of motion, but still without the weight. This week we can aim to control the posture past halfway from the squat. Week 3, we add weight to perform the squat to its entirety. Week 4, we perform a weighted barbell squat, thus combining all components of each week. This, as a result, increases the difficulty of the workouts weekly by keeping interest high. Week 2 add exercises like the box jump and a split squat to see further transfer of skill. One of the keys to effectively teaching the movement to a person is to determine their preferred way of learning. In the case of our participant, we determined that he absorbed the information best by observing and then performing the movement. With that, a correct demonstration of the exercise is necessary in the beginning. Gibson in 1979 suggested that viewing a movement stimulates the motor control system as if it too has performed the movement. The trainer briefly introduced the exercise, then silently demonstrated it a few times. Following that, he identifies 2 key points of the areas to focus on, then demonstrates the exercise again. Afterwards, the participant then performs the movement focusing on the same 2 points, then gets feedback stating to what degree he performed those points and how he can improve. It's important for the trainer to refrain from providing too much verbal information about the movement, as this may overload the participant's brain, causing him to think a bit too much about the movement, resulting in poorly executed attempts. For the participant to understand whether or not he's completed the task to a good degree, he should expect to feel constant tension in his lower spine if he's performing it correctly. This is known as task intrinsic feedback, where the participant can receive feedback from himself. Augmented feedback is where the trainer provides feedback for the participant. In this case, we give qualitative information of performance after every set based on the curvature of your spine. So for example, we may say, as you lowered yourself past 80 degrees of the squat, your back starts to curve out. Just remember to push your lower back in front of you the whole time. The reason we give qualitative feedback is that we can specifically explain what needs to be improved, as opposed to simply telling him, for example, their squat was a 6 out of 10. It doesn't really mean anything until you justify why it was a 6 out of 10. Quick 2 or 3 worded cues will be given during the exercise if the trainer notices any repeating issues. For example, shoulders back, chest out, or look straight ahead. However, only 2 cues can be used per set to avoid overcomplicating it. This type of exercise feedback is concurrent feedback. Week 1 consists of part practice where we do box squats and then the leg press. Week 2, we combine these 2 skills to create the body squat while still doing the leg press to gain strength. Week 3, we combine everything we've learnt to perform a weighted barbell back squat. And then finally, in week 4, we see how much we've learnt by transferring our skills to a front squat.